Do energy drinks affect your heart? Big question I get, of course. This is Diamond Fernandez here with the Heart Fit Clinic, your leaders in heart health. And today I'm going to talk about energy drinks and what they can do to affect your heart health. And so there was a study that was done, and it was just released here recently. And it basically took 3 to 4 hours after drinking 32 ounces of energy drinks, and it looked at their heart's electrical activity, and they looked at blood pressure. And when we look at an EKG or ECG, and really the difference between ECG and AKG is another talk, and it's just electrocardiogram versus electrocardiogram in German. But anyway, the point is that the electrocardiogram, there's a specific interval that we look at when we're looking at the electrocardiogram, and it's called the QT interval. And the QT interval, when it gets longer, it's more susceptible to heart arrhythmias. And so when they took this measurement afterwards, and so they measured the electrical activity and the blood pressure of the participants, and it was about 7.7 milliseconds higher at 4 hours compared to the placebo drinkers. And if this time interval is, of course, too short or too long, it can affect arrhythmia, and abnormal rhythms and life-threatening arrhythmias could possibly happen, but of course none happened in this study. But that's what happens when you alter the QT interval. That's the I got a whole talk on ECGs there, so that you can watch separately on that part of it. But when we look at the QT interval, when that's increased, that's not a good thing. And then the second thing that happened was we monitored blood pressure. And blood pressure was found to have about 4 to 5, I believe it was, millimeter mercury in this study, increase in systolic and diastolic blood pressure who consume the energy drinks. And so when we look at this, energy drinks are they should be used to have energy, but we really can't. The study showed that we can't really attribute this all to the caffeine inside of those energy drinks. Energy drinks, can contain anywhere in 32 ounces of a caffeinated energy drink. It can contain probably around 304 to 320 milligrams of caffeine per 32 fluid ounces, and so. And caffeine doses of 400 milligrams is not expected to include any ECG changes, but maybe it's something that we have to further investigate in looking into the combination of the ingredients inside these energy drinks. And that's something that we should maybe look for more as to what is the combination of these things inside energy drinks that can cause the problems, increase in blood pressure, or increase in QT intervals that way. So again, this is Diamond Fernandez with the Heart Fit Clinic, your leaders in heart health, and we look forward to helping you live happier,